Is that recording?
Yep.
Timer. Okay.
Recording in
All right.
progress.
So today I'm going to be talking to you about the osteokinematics and myology of the glenohumeral and scapulothoracic joint. For starters, we're going to talk about the myology of flexion. So flexion is just this motion can be observed through the sagittal plane of the medial-lateral axis. The myology involved is going to be your pectoralis major, which originates in the second to sixth of your ribs, your sternum, as well as the inframedial portion of the clavicle, and it inserts at the greater tubercle of the humerus and your lateral lip of the bicipital groove of the humerus as well. Secondly is the anterior deltoid. The anterior deltoid originates at the scapula and the clavicle, and then inserts there at the deltoid tuberosity of your humerus. There's also the coracobrachialis involved, as well as the biceps brachii tendon, but the biceps brachii is very weakly involved, so we don't talk about it too much. And then moving on to extension, which is going to be this movement, can be observed also through the sagittal plane of the medial-lateral axis. And then the myology involved with that movement is going to consist of the posterior deltoid. Your posterior deltoid originates at the inferior edge of the spine of the scapula, and then it inserts there also at the deltoid tuberosity of your humerus. And then secondly is the latissimus dorsi, also known as your lats. They're back here, and they originate at the thoracolumnar fascia, as well as the spinous processes of the lumbar and lower 6 thoracic vertebrae, down there near your lower back. And then it inserts at the floor of the bicipital groove of the humerus. And there's also the teres major muscle as well, contributing to extension. Now we'll move on to abduction of the glenohumeral and scapulothoracic joints. This is going to look like this or this, but mainly just this, and it can be observed through the frontal plane of the anteroposterior axis. And the myology involved with abduction is going to be your supraspinatus muscle. The supraspinatus is responsible for about the first 15 degrees of abduction, and its origin is going to be in the supraspinatus fossa, and it inserts there at the greater tubercle of the humerus as well. Secondly is going to be the middle deltoid. The middle deltoid is responsible for about 15 to 90 degrees of the abduction of your shoulder, and the middle deltoid originates at the acromion of the scapula, and then also inserts there at the deltoid tuberosity of your humerus. And then lastly, responsible for about 90 degrees plus of shoulder abduction is going to be your serratus anterior muscle, as well as your trapezius muscle. And then moving on to adduction of the glenohumeral scapulothoracic joints. This is going to be when you're going back and down. That's adduction. Can be observed also through the frontal plane of the anteroposterior axis. And this motion's myology is going to consist of the pectoralis major, which I talked about earlier, as well as your latissimus dorsi, as I talked about earlier, and the teres major. The teres major originates at the inferior angle of the scapula, and then inserts at the medial lip of the bicipital groove of your humerus. And that's what I'd assist with abduction. And then moving on to internal rotation of the glenohumeral joint. Internal rotations got a lot of myology. Can be observed through the transverse plane of the longitudinal axis, but it's consisted of 5 muscles that help this motion work. One being the subscapularis. Its origin is going to be at the subscapular fossa, and then it inserts at the lesser tubercle of your humerus. And then there's also the pectoralis major, the teres major, the latissimus dorsi, and the anterior deltoid, as I've already talked about. But that's internal rotation, and then external rotation of the glenohumeral and scapulothoracic joints is going to consist of three muscles, or three myology, or that consists this motion allowed to function. Can also be observed through the transverse plane of the longitudinal axis. And the myology involved is going to be the infraspinatus muscle, which originates at the infraspinatus fossa, and then inserts at the greater tubercle of the humerus. Next is the teres minor muscle, which we haven't talked about also yet. The teres minor originates at the lateral border of the scapula, and then inserts also at the greater tubercle of the humerus. And then last but not least also is the supraspinatus muscle, which we've already talked about. The supraspinatus muscle also helps with external rotation of the glenohumeral joint, and like I said before, it can be found in the supraspinatus fossa, and then inserts there at the greater tubercle of the humerus. And then to explain all of this, to explain this chaotic stuff, this chaos of the myology and osteokinematics, is the six principles of the shoulder complex, the six kinematic principles of the shoulder complex, and these six kinematic principles basically say, so the first one says that throughout 180 degrees of shoulder abduction, it's based off a generalized 2:1 ratio of scapulohumeral rhythm. This basically says that about 120 degrees of that abduction, the glenohumeral joint is primarily responsible for, and then simultaneously 60 degrees of that abduction, the scapulothoracic joint is responsible for. And the second kinematic principle basically says that during that 60 degrees of upward rotation of the scapula, it's basically a result of two simultaneous movements, one being elevation of the clavicle at the sternoclavicular joint, and then upward rotation of the scapula at the acromioclavicular joint as well. The third kinematic principle basically says that during shoulder abduction, the clavicle retracts at the sternoclavicular joint. The fourth kinematic principle says that throughout shoulder abduction, blanking. Fourth kinematic principle says that throughout shoulder abduction, during the upward rotation of the scapula, it also begins to posteriorly tilt, and then near the final stages of shoulder abduction, it externally rotates. And then the fifth kinematic principle says that during and throughout shoulder abduction, the clavicle posteriorly rotates about its own axis, and this ultimately contributes to the mechanics that allow the scapula to upwardly rotate. And then the sixth and final kinematic principle basically says that throughout shoulder abduction, the glenohumeral joint externally rotates. I hope I explained it well enough. I hope you have a better understanding, and thank you.
Recording stopped.
I saw 5 minutes. I don't know if I did that right. Dude, he probably does want us to do the joint movements and the elevators and the depressives and last one was 10 minutes. Then he wanted us to add the 6 kinematic principles. So maybe it gives us an extra 3 minutes for that.